All right, meanwhile, President Trump turning his focus to health care. So what needs to be fixed right now? That is a conversation you're going to hear next right here on Fox and Friends. President Trump says the Republican Party will soon be known as the party of health care. So this week, we're taking a look at what needs to be done right now to make this system work for everybody.
Here to kick off our series is co-founder and president of the Foundation for Research on Equal Opportunity, Avik Roy. Avik, great to see you. Thanks for being with us.
Hey, Ainsley, how are you?
I'm good, thank you. So tell us about the healthcare system. What is broken, first of all?
Well, a lot of things are broken, but what it comes down to at the end of the day is healthcare in America is too expensive for everybody. That's why so many people are uninsured. That's why so many people struggle with their bills. And it's the federal government over 70 years that has made it so expensive.
Sure. My daughter's got Obamacare, and she can't afford to use it. I mean, the premiums are through the roof. She never meets them. She winds up paying out of pocket. It's not how it's supposed to work. So, Avik, what should, and maybe some lawmakers are watching right now, what could be done here in the United States to fix it?
Well, the first thing to know is the president, when he campaigned for president, when he became president, he promised that his health care plan would ensure that every American can have affordable health care, that we'd have health care for everybody. And there are plans out there that do that. Bruce Westerman, a representative from Arkansas, has put out a plan called the Fair Care Act that tackles a lot of the problems with our health care system. Again, the things that make it so expensive. Tackles high hospital prices, high prescription drug costs, and the high cost of insurance, both in Obamacare and for other people who get insurance through more traditional means.
What can Republicans do to actually become the party of health care?
Well, you got to tackle hospital monopolies, which are a big problem driving healthcare costs up. You got to tackle the high cost of prescription drugs, which the Trump administration is doing a lot to tackle. And you've got to give people more control over their own healthcare dollars so they're not actually subject to all these regulations that drive up the cost of health insurance, both for Obamacare and for people, again, not on Obamacare.
Okay, so on the Democratic side, when Bernie Sanders and others say we're for, Obamacare, Medicare for all, it sounds great, but is that doable?
Well, what they're supporting is not actually Medicare. It's a single-payer plan that would be very different from the way Medicare works today. You know, about half of every class that graduates into 65 and gets on Medicare today, they're choosing private insurance. They're not choosing government-run insurance. The program called Medicare Advantage is the program where all the growth in Medicare enrollment is. So actually, Bernie Sanders' plan would take that away from people. And so the real solution, I think the solution that Republicans support, is one that builds on what Medicare Advantage does well, using private insurers to compete against each other so that the quality of your coverage is better.
All right. Avik, thank you so much for being with us.
Thanks a lot, Ainsley.